I was always a dabbler in drugs, and I had a wife, 3 kids, house, great job, and I just started doing heroin, and it got out of hand really fast. And my ex-wife left me, took the kids, then I lost the house, the job, ended up on the street, and ended up in jail. When I arrived at Ludlow, I was 140 pounds. I was yellow, really bad yellow, and people would just like stay away from me. And my teeth are falling out of my head because I was all rotten out.
We're the receptacle for, if you will, all the medical problems that are present in the community. 93% of them lack any kind of vocation, any marketable skill, 85% with drug and alcohol issues, 30% of the people that leave here, are homeless.
COCHS is a nonprofit organization. We're established with a mission to help local jurisdictions around the country merge the community health care capabilities with the correctional health care needs in their local jails or houses of correction. Many of them may have only discovered that they had an illness when they got to jail because they've been self-medicating with drugs or alcohol for a while. They've never had any serious health care services provided in the past. So this may be their first connection to quality medical care. So let's take advantage of this opportunity.
Do you feel you've had any risk from your contact with HIV?
It's possible.
Possible. Would you like to be tested?
Yep.
The overwhelming majority of our inmates only came from 4 neighborhoods. So when an inmate would come in, he's diagnosed with XYZ, we would find out by zip code where he was going to be returning to and established a doctor-patient relationship with the physician from that home neighborhood. Ultimately, what we wanted to achieve from this was not only provide adequate care inside the facility, but set up continuity of care when the inmate is released.
What's exciting about this, what I call new paradigm, meaning working with law enforcement, working with our public health department, working with our medical community, working with all of the nonprofits that exist, is that that there's no question. The longer they are involved with us, there's no question we have a great impact on public safety in our community and the, quote, the quality of life.
The percentage of people with HIV from our community who are in jail has steadily gone down in comparison to other communities. So we think that by surrounding people with all of these kinds of programs, we're making a positive impact in their lives. Healthy people, having healthy people are important to any community. Everybody deserves the opportunity to be as well as possible.
I started seeing Dr. Lincoln, and I really didn't want to see a doctor. I just, wanted to get out of jail. And he was telling me, I need to do all these tests to find out how deep a problem I've had, He said, then we'd have to start you on some kind of a program to get your health back, because that was number 1. And then, because while I'm trapped there, he says, you might as well get things done. And I got out, they let me out on a pre-release for a work release first. They said I had to go see a doctor, aftercare, and the doctor happened to be Dr. Lincoln. My health now is probably excellent. My life, I'm remarried. I've got 7 grandchildren now. I've got 8th one on the way. I have a good job working in a machine shop. I don't know, things going good. I do my own program outside to stay off. And I do keep in touch with Dr. Lincoln. He's gave me his beeper number and cell phone too, so if I ever needed him. Who does that,